Alright, Lisa, I'm making this video for you, so here's the stuff we should do to help keep you moving well, reduce your pain, and hopefully stabilize your hips and your lower back. Okay? So we're going to start off with box breathing, 3 to 5 minutes. I'll go over a couple of key points. I'll demonstrate on the floor. Feet are up, knees are bent, nice and relaxed. Sometimes it wouldn't hurt to put something right behind our neck to support. You want to try to keep your spine neutral and then relax. And then my focus while I breathe is, one, we want to breathe into my fingers, breathe into my thumbs. And then relax. And then while I'm breathing, I want to kind of go from head to toe and start thinking about releasing any tension. Start with your top of your head, your eyebrows, eyes, face, neck, shoulders, and work your way all the way down. Okay, if you wander, if your mind starts to wander, that's okay. Just bring yourself back in with breath and focus on relieving tension. Another great visualization when breathing, especially when I'm having some low back tension, low back pain, is to breathe and visualize the breath coming in my nose and going down along my spine into my tailbone or down to the sacrum. So I'm just going to inhale, and I feel it going down my spine on each side, ending up into the sacrum, and then exhale, it goes back out. A couple other key points is, one, you want to make sure that your rib cage is expanding three-dimensionally. So I'm feeling for expansion laterally. This is expansion anteriorly or forward, and then you should feel expansion into the mat. If you're not feeling it in the mat as much, then I would go into quadruped and do a cat position gently and breathe into that tightness. So it will look like this. So there's neutral, right? I'm going to come up into cat. And I'm supposing that when we're flexed, the diaphragm isn't going to be able to go extend out this way as easily, so it's going to start going backwards into the spine, into the posterior rib cage. And that's the feeling I get when I do it. So that might be a good way to work on the posterior rib cage, which is usually the most difficult part to get breath or rib cage expansion. It gets pretty tight back there. After you do that, you're going to do your quadruped rockback. Okay. I took out the leg lowering and the post-hip flexor mobility just because I've had those sometimes destabilize the hip. So we'll take those out, see how it goes from there. We can always add them back in if we feel that we need to. Okay. So quadruped rockback. I'm going to push the ground away, set the core, and then set the toes like you're in your squat position, and then you're going to rock back as far as you can, keeping the spine aligned, and then back out. So I'm going to inhale here, exhale here. Okay? Don't go so far back that you round your back. This isn't that child's pose stretch, okay? We're patterning your squat pattern. We're trying to maintain core stability while moving your hips, okay? The unilateral rock back, okay? This one and the quadruped rock back are put in there to help stabilize the core, mobilize the hips, and the unilateral one in particular is going to maybe mimic my hip centering when I work with you and I center the hip and apply the pressure, right? So all we're going to do is get into our quadruped position, reach around. My hands are going to move over so I can keep my spine straight, neutral. That effectively puts me into internal rotation and adduction, adduction of the hip. And now I'm just going to rock back. And I don't want to go so far that I start to round my spine again. I want to keep most of the weight right over the top of the knee. And then it's not out of the question to draw some circles with the hip over the knee. You know, I'm not getting way back here. That's defeating the purpose. And we're not trying to do a pigeon pose stretch here either. Just trying to mobilize the posterior capsule of that hip and center it. And I already, in that little bit, I could tell that my hip was starting to get more mobile just by doing that, okay? So after we do that, some mobility work. And I didn't mention this, but you still need to do your myofascial work. That's your foam rolling, your lacrosse ball work, and I'll touch on that at the end. But anyway, do that first after you're breathing, okay? After the quadruped rock back and the unilateral rock back, we're going to go into a little more stability based movement, and we're going to do your yoga block bridge. Let me grab the block. We put it between my knees this way. Feet are flat. Just going to gently squeeze, lift, take a breath, and then down. Do that 12 times. So squeeze, gentle squeeze. You don't have to crush the block. Just squeeze it, activate the adductors, lift, extend the hips, breath, and then back down. Okay? Number 2 is the minivan bridge. Hold on, let me get one. I forgot it. Take your minivan. Put it around your knees or your thighs right above your knees. Same position. It should be pulling your knees in. Your feet are hip width. And then you're going to set your knees at the width of your feet. Okay, or hip width. Then we'll lift up. Breathe, and then back down, and do that 12 times. You can rest here if you need to. Activate, lift, breath, and then down. Okay? So that's your mini bend bridge. then side plank. Make sure the elbow's underneath the shoulder, your spine's neutral, don't lift too high. Honestly, I would keep the bottom knee bent for now. Okay, you're gonna do both sides, and you're probably just gonna hold that for 30 seconds.
About 15 seconds left.
And then after you do that, let's do the adductor mob. We did this yesterday where we're in quadruped. Let's sit back and then walk out. Notice my toes are up, legs out the side, back stays neutral. Stretch that adductor. You can also rock it back, just like a rock back. But just keep your spine straight and neutral, okay? Both sides, 12 reps. And then finally, wall march for 1 minute. So remember, when we march, and I'm just gonna demonstrate this way, my hands are on the wall. I want my foot to remain straight. I don't want turning, ankle, this, that. Just come up, neutral, dorsiflexed, other side. Okay, and then you're angled from the wall. You're pushing into the wall with some force. You're gonna do that for 1 minute, rest, then do another minute. So two reps for 1 minute each. Okay? Hopefully that helps. I'll write this in the description on the video, and then also I will attach or link the video into a Word document. Okay, you gotta do this every day. Every day. This needs to be done so that you can stabilize your core and your hips. All right.